So some food for thought, some things you can start thinking of. But if you're sitting there going, okay, tell me how to test. Tell me how to test, Dr. Kelsey. I'm not going to gatekeep that for you here because I think this is a really important conversation. There's 2 different avenues that you can go down and then a third avenue that I'll mention as well. So gold standard being our clinic testing, which is an imbalances biopsy. They actually go in, they take a little piece and they test for various types of inflammatory cytokines as well as good and bad bacteria. Actually, I'm not sure if you need to do receptiva with that imbalances to get the inflammatory cytokines, so don't quote me on that. Those 2 tests sometimes go hand in hand together. It's completely up to you. We do talk about the receptiva test in the endometriosis unexplained infertility episode as well, if that interests you. So you can go back and check that one out. But the imbalances is the one that specifically looks at the bacteria. Some clinics don't offer this. Other clinics typically don't offer it until, like I said, you've had failed euploid embryo transfers. So if that's your case, when you're asking for this type of support, there is another at-home option that you can order. It's through a company called Fertility. They offer a few different types of really cool advanced maneuver testing, but we recommend the full female microbiome. If you actually use the code FCM at checkout, it'll get you 5% off that test specifically. And you you send in a menstrual blood sample as well as 2 vaginal swabs. So you get to see your uterine via menstrual blood and you get to see vaginal canal health as well. And what's really cool is that they will also give you treatment recommendations at the bottom based on what they find in that test. So those are the 2 options that we have our clients in Fertility Confidence Method seek out when we're thinking that this might be a piece or a factor for them. The third option is to just do a vaginal swab. It's not going to be the same. We can assume similar bacteria that are in the vaginal canal are also in the uterus, but just if your vaginal swab comes back clear, it's not a guarantee that the uterus is good as well. But it's better. It's a good thing to try at the beginning. The imbalances, the fertility testing, it's an investment. So if that's not on the table for you at this time, then the vaginal swab, something like Evie is an at-home product. Your doctor can also do a ureaplasma, mycoplasma swab when you're doing a PAP, where you can go in and ask them to do that extra. There are some options, but just know that it isn't quite robust enough for us to say the microbiome is good, but it could be a good place to start. If we see that your lactobacillus is low in your vaginal canal, it's likely lower in your uterus. And so starting to work on that essentially. Hopefully this helps you start to kind of think and wonder and ask some different questions around how this might be impactful for you. As always, we're here to support you. If you're like, Kelsey, this sounds excellent and I know I need help with this, and advocating and giving me a treatment plan, Fertility Confidence Method doors are open for you. You can schedule your clarity call. We'll get to know you a little bit better. Make sure that this is a good fit for you. I'll pop the link down in the show notes, but it's just downloads.kelseyduncan.com/results. And we'll build you out a personalized care plan, but we'll also give you all of the hands-on support, one-on-one coaching, training, everything that you need to build out your dream family. We become a team. We're with you until you don't need us anymore. And it's a really fun community to come in and just get all of your questions answered, but more importantly, get the support that you're maybe not getting from your current care team.